Health insurance exchanges, essentially open markets for purchasing health insurance, are a linchpin of the Affordable Care Act. States have the option under the law to set up their own exchange, partner with the federal government, or let the feds run the exchange. They can also opt out of the exchange altogether. So far, Maryland is one of 16 states to decide to go on its own. Physicians are playing a role in setting up the Maryland exchange and will be called upon, eventually, to provide quality data directly to the exchange. We sat down with Rebecca Pearce, Executive Director of the Maryland Health Benefit Exchange, to get more details.
No, so the exchange is really just a forum. It's really a new sales channel, essentially, to purchase health insurance. It is, people will be enrolling in existing carrier insurance, whether it be the local Blue Cross Blue Shield or whatever the case may be. So their card that the individual carries is going to be the same card that they carry today, whatever that carrier card is. So they're not going to need to do, providers are not going to need to do anything different except just take them in and see them. Our current grants carry us through the end of 2014, and the exchange must be sustainable beginning in 2015. And so in our 2012 legislation, the legislation lays out that we must have a recommendation to the General Assembly by December 1st of this year. There is also created by that legislation a joint executive legislative team that's going to take a look at those recommendations. We're working with a consultant right now to define what our operating budget is going to be beginning in 2015 and also what our options are. There was a recommendation from the Exchange Board in 2011 to the General Assembly to say that funding mechanism should be both a broad-based funding mechanism that should be a thin, broad-based funding mechanism that would be supplemented with a transaction fee for possibly, for example, carriers in the market. So we're taking a look at those from a fundamental perspective, taking a little bit more detailed this year, and that recommendation will go to the General Assembly. It's ultimately the General Assembly's decision to make. When we talk about a broad-based fee, we're talking about possibly doing a tax or something as broad as a tax. Could be a hospital assessment, but also could be something as narrow as looking at providers and looking at their licensure fee and adding some cost to that. It's ultimately up to the General Assembly to make that decision, and the recommendations will be put forth from this joint executive bipartisan Executive Legislative Committee December 1st. Well, as with any other situation, there's a policy team that would take a look at things. Maryland is committed to health reform, but we would have to just wait and see what happens.